Hello, welcome to Nutritional Medicine by Lab Analysis. My name is Dr. Cyrus Thomas. I've been a chiropractic physician practicing nutrition in an orthomolecular way, much like any other doctor who does nutrition, for some 34 years as well. I also have a doctorate of homeopathy from India. That was an extensive program. We're using blood, urine, and hair analysis to diagnose for chronic illness. So what we're doing essentially is we're using all of the best that modern medicine has to offer today in laboratory analysis, and we're taking that information and we're running it through different computers. We're modernizing essentially the entire process, comparing results to healthy people who do nutrition, finding out what your blood values really should be, not just compared to all of the sick people going to the blood labs around the country, but rather to people who care more about their health, like hopefully you do. And then, instead of using pharmaceutical man-made molecules to treat people, we use nutraceuticals, which are naturally occurring molecules in nature and have a much longer history of knowing what to do with them and how to use them. So let's go into today's show. We're going to be talking about the cost of lab testing, and the reason why we're doing that is because oftentimes people have insurance. They get their lab test done through their doctor who bills their insurance, and because the insurance company puts restrictions on it, they usually test about 25, 26 different items in the test. We like to test 52 items. We feel 52 items are necessary to know what your status of health is with a blood test. We also like to do about 30 tests on the hair for heavy metals and different minerals in the body. Let's talk about the cost of lab testing and what you can do to make it work for you. All the prices quoted in this show are the average pricing for doctors in California using the most popular laboratory service centers. So none of these are my prices. Let's talk about the cost of healthcare over time. In 1950, it was about 5% of the GDP. Okay, now in 2010, we are up to 16%. So clearly, if we are 39th in world health, according to the World Health Organization, then something is wrong. Why has our GDP gone from 6 to 16%, and yet we rate so poorly in infant mortality, in availability of health care, in mortality in general? Now, alternative modalities of healthcare include nutritional medicines. We do blood testing for that, saliva testing. In saliva testing, we're testing for hormones and different allergies. We can also do a hair analysis for heavy metals and minerals. Another type of alternative modality besides nutritional medicines is homeopathic remedies, acupuncture treatment, chiropractic treatment, and herbology. The conundrum is that these are rarely covered by insurance. If you must have your health care covered by insurance, you will need to receive pharmaceuticals to treat your symptoms. Do you want to have your symptoms treated, or do you want the cause of your ailment found out? We know, everybody knows, that pharmaceutical medicines oftentimes are very good at removing the symptom, but almost never remove the cause of the malady. The cause of the malady lies in you needing the proper molecules in your body to make the cure. The pharmaceutical medicine does not provide those molecules, and that's not a surprise to anybody. That's the way it always has been. So if you say, I can only do health care if my insurance covers it, then you are saying, I'm going to go to regular doctors, I'm going to receive pharmaceuticals for my health care. And you'll be stuck in that, and you won't be using chiropractic, herbology, acupuncture, nutrition, and homeopathics. A solution: you can always use insurance for the diagnostic testing, like the blood test and urine analysis, although they're probably only going to do 1/2 of the testing that we would do. You can use them for the testing and then use natural healthy substances to treat instead of using too many pharmaceuticals, which are man-made molecules that treat symptoms only. Here's what the average child in Britain eats. It's really quite a mess. This is all processed, packaged food, canned food with, each can has a lining of varnish in it. That's why we shouldn't have canned foods at all. Also, when we go to restaurants, we're getting a lot of canned food too. So that varnish layer inside the can needs to be addressed. It has bisphenol phosphates in it. They need to go. They cause a lot of problems. This poor little kid hardly has a chance of making it to 90 years old and still feeling good about himself and life. This is what the average American eats. There's a little more meat hanging up here. There are, which is, a much more natural state if they raise the beef and pigs naturally, grass-fed and whatnot. There are some cheeses, there are some vegetables and eggs and milk and dairy. There's less processed food in here, but many Americans eat processed food in fast food restaurants, and we actually have the highest rate of homicide in the world, which relates to not so much our gun laws, but actually omega-6 oils. And all across the globe, they've done a study that correlates precisely homicidal rates and omega-6 consumption versus omega-3, which are the good essential fatty acids. Then in addition to that, we need the right saturated fats, which come from animal products like milk and cheese and meat and fish. Science-based nutrition is a group of doctors using nutrients for medicines. They have collected blood, hair, and urine values on thousands of patients and use this information to be able to tell you and your doctor which nutrients work best for your imbalances. That's the 52-element blood test. This was the patient's first test. 5 months later, they did a lot better. We can tell by the color change. Yellow is for warning, red is for high risk, and blue is critical. So when a blue goes to red, that's good, but when a blue goes to yellow, it's even better. It's gone 2 stages towards being better. If it remains white with a green star, then it's healthy from the get-go here. These, you get a few whites here. These reds went to white. These whites stayed white. This red went to yellow, red to yellow, and a red to white. So we can see very quickly, and we can actually do a series of tests. Say a person gets 6 different blood tests because they have a chronic ailment over a 6-month or a 2-year period. We can put those all in parallel so that we can see the progression of improvement, and we can also see what has not improved in time so that we can revise the nutritional program, ameliorate what we're doing. Average prices for blood testing. A chem profile, the 52 elements, is about $250. A complete blood count with a differential, that means looking at different types of white blood cells, runs $100. Cancer markers can be from 35 to 180, depending on how many markers we do. Vitamin D is about a $72 test. Female hormones can be $225 if done by the blood. If done by saliva, which is what this shows over here, we can actually find these values through testing saliva over a month's time and get the entire month cycle in graphic form. That runs about the same price, nearly $200, and a prostate-specific antigen for men is only $32. Those are average California prices. Blood testing, when we do the chem profile, we're looking at a thyroid profile, liver profile, kidney markers, electrolytes, which help create mineral balance in your blood, inflammation markers, which are very oftentimes the same as the cancer markers, and pancreas and sugar values, because we've got to look for obesity propensity and a propensity towards diabetes as well. When we do this complete blood count with the differential, we're looking at the red blood cell count, the shape and the size of the cells to see if there's any anemia. We're looking at white blood cell count. We're looking at the number of different types of white blood cells. And we're looking at the sedimentation rate, how quickly the blood will settle. That usually is a good marker for inflammation in the body. And of course, if a person is having too much sugar, too much alcohol, too much cereals and legumes in their diet, they can create a state of dysbiosis in their intestines. That will cause inflammation. And we can measure and find that degree of inflammation so that we know how seriously we have to take this issue. This is the nutritional profile 15-page report that we do. It has all of the complaints that the patient feels, all of their symptoms or presenting symptoms. Then we go into primary findings and look at the medications they're on and what side effects those have, because we have to know what symptoms come from side effects. We're interpreting all of these results. We're looking at a coronary risk assessment, a possible diabetes, inflammation, possible anemia in this patient. It teaches you how to read the blood values on the report, and then we teach you how to read the hair values. This person had high arsenic, high cadmium, as well as a high mercury. Those are problems inside the bodies. Those metals heavy metals are like free radicals, and they're attaching to things they shouldn't. We also go over diet. We go over nutrition, exercise rather, nutrition of course. It's about 15 pages and it's incredibly comprehensive. Here it is with the 52 element blood test, first and last. This person had 6 successive tests done in a row, so we were able to make a comparison. And you'll notice there's far less color at the left side. This is the hair analysis, the first test and the successive test. These were, again, the hair analysis for the good minerals. And these were nutritional recommendations that Science-Based Nutrition came up with for this patient. And then I, as the physician, can override some of these recommendations because I know the patient more intimately than the computer does, in spite of the blood and the hair and the urine test being looked at by an incredibly comprehensive computer, and the hair analysis as well. I still know the patient better because they've been in my office. A hair analysis can run about $150. A meta-oxy testing can be $75. That's where we test the urine for a substance that tells us how well we are dealing with the toxins in our body, how well we are able to detoxify the toxins. Urine heavy metal versus hair analysis for heavy metal can run $225. That's a very comprehensive test. We then use a substance called DMSA, which is a chelating agent, to run those heavy metals out of the body. You take it for 3 days, you rest for 11, you take it for 3, you rest for 11, you do 5 cycles of that, and then we're able to retest the urine for these heavy metals and see what results we have produced. What is a nutraceutical? People think, oh, there's just vitamins, minerals in the health food store, and you know, maybe you take them, maybe you don't. Some people say you need them, some people say you don't. Well, in the science of nutrition, that is just ludicrous, because we know that nutraceuticals are extracts of food with a medicinal effect on human health. The nutraceutical is usually contained in a medicinal format, such as a capsule, tablet, or powder, in a prescribed dose. More rigorously, the definition of nutraceutical implies that the extract or food is demonstrated to have a physiological benefit or to provide protection against chronic disease. There's no reason why we can't feel good and healthy and sexy and good about our self-image have a good sense of humor, want to go to museums and see movies and travel and have fun with our life and be creative and have hobbies and have friends. All of this can last all the way into our 90s if we do things right. We now know how to do things right. There aren't that many mysteries in nutrition now. So you can take part in this if you move away from scary medicine, fear-based medicine. Oh, you've got a symptom, well, we have to make that symptom go away. Instead of that, say, I've got a symptom, I have a problem, let's cure this problem. Let's find out what is at the base of it, and let's really do something about it and cure it. You can do that. The last 30 years have shown an explosion in nutritional knowledge. Nutraceuticals are medicines, they are complex molecules. It's not as if pharmaceuticals are real medicine and these are not real medicine. These actually are the real medicines in the body. Why? Because in order to turn a molecule A into molecule B, for example, we need an enzyme. This object at the bottom is the enzyme. A molecule comes in, it's changed by the enzyme into these two, and off they go to do separate jobs. Enzymes break things up and change the shape of things. They actually change the atoms that are in the molecule. What if we're turning molecule A into B, C into D, E into F? What are some different types of enzymes? Well, a vitamin can be an enzyme. A mineral can act as an enzyme, and an amino acid can act as an enzyme. If you're not taking any of these things, but instead you're taking pharmaceuticals to cover up a symptom, you are not turning your molecules into the molecules they need to be turned into. This is so essential and so crucial for health that I want to make a point about it. What is the Code of Honor by Dr. Van Merkel? He started science-based nutrition. I have immense respect for him. He says it is an awesome responsibility when a person comes to me. I must do my best. I must not be distracted. I will not order one test or recommend one vitamin more than is necessary. But neither shall I shirk from my duty. Without health, how can one fulfill their optimum potential or purpose in life? What does it mean he will not shirk from his duty? It means that if he thinks you need to do X, Y, and Z, and you say, I'm not interested in that, he's going to say, no, you need to do X, Y, and Z. This is what will cure your problem. It is the physician's, the practitioner's responsibility to be firm with the patient and to say, we know what causes this problem. I can send you onto Wikipedia, Google. You can find the information that will agree with what I'm telling you, and this is what will work for you. I highly recommend you do it. My office, it's really quite a lovely place. It's that window right behind the tree there. But go to my website, integrativealternativemedicines.info. You're going to find a lot of information there. You're also going to find a place where you can watch all of the TV shows that we've done here at the Community Media Center of Marin, some 25 shows on YouTube. With the click of a button, you can look at the name of the ailment. This was not a show about ailments. This was about the cost of lab testing, just so that you know what is involved. It's really not all that expensive. Some people think it's going to be $2,000, $3,000, $4,000, but it's really in the lower hundreds to get all of this testing done. Integrative Alternative Medicines with an S.info. Thanks to the Community Media Center of Marin for the show, Vita Flores for being our director and helping to put this show together. My phone number is 415-847-5020. Again, integrativealternativemedicines.info. And we have a little extra time here today, so I'm going to back this up a little bit. It sort of jumped ahead on me. And go over a few issues that I think are fascinating. I always put extra slides at the end of a show so that I can go over them. Here we go. Molecular treatments. In other words, treating a person with molecules. What are we talking about? Well, if we use naturally occurring molecules like enzymes, vitamins, amino acids, minerals, herbs, it makes up for what is missing in our food. If our food was perfect, we wouldn't need these things. Naturally occurring molecular treatments also supplies what the body would normally require. You're only giving it what it would naturally require anyway to function well. It's not a surplus. And it makes the body work the way it did before it became ill. So many people think, well, now I have this illness. It even has a name. That means they know what it is. And I guess I have this for the rest of my life because now I have it. Not so. A few months back, you didn't have it. What changed between a few months back and today to where you have this illness? Something went wrong. Some molecules are not working the way they did before. Find the cause, correct it, do no longer have this disease, and move on with your life. If you take controlled drugs or pharmaceuticals, these are man-made molecules. They're different than what are found in foods or in healthy bodies. None of the pharmaceuticals that a person takes are normally found in the body, very rarely so, and they're not found in foods, so it seems a little bit strange to take them. They treat the symptoms. Most of us are fear-based. We want our symptoms removed. Do whatever it takes, remove the symptom. Now, if your car doesn't work and your transmission is faulty, you put a new transmission, off you go, $3,000, $4,000. When the body doesn't work, people say, well, let's just put a new one in. Give me a new heart, give me a new kidney. That's sort of a strange way to do things when you could fix the one you already have rather than to go onto the surgical table. Most trends are asymptomatic. In other words, this means that as you're getting sick, you don't know that you're getting sick. Why? Because you're asymptomatic. You don't have symptoms and you're getting worse and worse. That's one of the reasons why we do the testing. Blood, hair, and urine, saliva, stool for parasites. We do this testing so that we can find out what's wrong with you even though you are asymptomatic. The masking of symptoms. There's a constant symptoms make us lose conscious awareness of pain. This means that if you have a pain, a symptom, and it's there all the time, it's constant, you're probably going to get used to it. You're probably going to forget about it because you're so used to having it. And you actually think it's part of you, that it is a natural part of you. It's the role of the physician, the practitioner, to go to the patient and say, this is not good, this is not normal, we need to correct this. And they say, well, my doctor said it couldn't be corrected. And you say, well, I'm telling you it can be corrected, and this is what we need to do. So let's try this for 2 or 3 months, and it's probably going to work. Don't stop your medications unless you make changes. We're not asking anybody to go out into no man's land. We're starting a program of actually changing the molecular structure in the blood. Once that has been begun, the person will begin to get better. They will usually know on their own when it's time to reduce or stop a medication, and they can go back to their pharmaceutical prescribing practitioner and negotiate that with them or just make the decision on their own. Man-made molecules is pharmacology. They work well for what they were designed to do, but it has 30 side effects on the average. However, a naturally occurring molecule is a nutraceutical. They work well for what they are famous for doing, and they have an additional 30 good effects, the likes of which we are still discovering. So rather than take a man-made molecule that fixes one thing you're trying to fix, but which has 30 side effects of things you don't want to happen, if you take a naturally occurring substance, it will not only work for the thing you're taking it for, but it will have 20, 30, 40 side effects that are wonderful for your body, because natural substances have almost no side effects whatsoever, and there's hardly any contraindications to worry about. That's because all of the medicines are friendly. Changes to nutritional prescriptions. Again, we need to change your nutritional prescription as the months go on. Sometimes you're on a parasite program. Sometimes we're working against microbials such as protozoa, bacteria, or viruses. Other times we'll go after parasites. Sometimes we will go after cellular cleansing, which is something we have to do when the patient asks us to give them substances because they have cancer. We don't treat the cancer per se. We don't have to. We treat the patient, and the patient treats their own cancer. Paul Twitchell, the former spiritual leader of Eckankar, said that taste is consciousness. What are we really talking about here? Well, if you love chocolate milk and you drink 3 or 4 glasses, it won't taste good anymore because you've been satisfied. So that 5th glass of chocolate milk doesn't taste good. It only tastes good when we want to bring it into our body. In other words, we can almost say that there's a consciousness associated with foods and the ones we're attracted to, which is the same as cravings and addictions. It's very interesting. This, by the way, is Francis Pottinger. He did a lot of great nutritional work in the 40s. This is Royal Lee from Standard Process. He had 105 different patents and came up with the idea of using whole food medicine to treat nutritionally rather than vitamins that are made of isolated molecules bought from all over the world and mixed together. We'll do one more slide here. Changes to nutrition. I like this quote. Max Planck said that scientific theories don't change because old scientists change their minds. They change because old scientists die. It's going to take a long time for nutrition and homeopathy, chiropractic, herbology, and acupuncture to be fully mainstream medicine in this country, but it will happen someday. Go to my website, watch the other shows. If you have a thyroid condition, endocrine condition, whatever it might be, you can learn something by watching the program. We air every Tuesday night at 8 o'clock. And once again, thanks for watching, and may you be in good health.